Hey, welcome to The Explainer. Today, we're cracking open the Occupational Therapist's Toolkit. We're going to look at the strategic thinking they use to turn big theories into real, life-changing results.
So, you know how life can just throw you a total curveball? A brain injury, a new disability, a mental health challenge. It can leave you feeling completely lost. How do you even begin to find your way back to doing the things that matter most? Well, in occupational therapy, that roadmap is very real, and it's surprisingly structured. In the OT world, that roadmap is called a frame of reference, or FOR for short. You can think of it as a specific set of instructions, a practical guide that answers the biggest question of all. How exactly does a therapist step in to help someone get their life back? And honestly, this is the perfect way to think about it. A general model of practice. That's like the architect's blueprint. It shows you the big picture, the final vision. But the frame of reference, that's the toolkit and the instruction manual. It gives you the actual tools and the step-by-step guide to get the job done. Okay, so every single therapeutic journey starts with this one huge strategic decision. When a person can no longer do something they used to, should the goal be to restore that function, to get it back? Or should the focus be on adapting to that loss? This choice is the first domino to fall. It determines everything that comes next.
And that choice, it really splits into two main paths. The first is the remedial approach. This is all about trying to fix the underlying problem, to restore that lost function. The other path is the compensatory approach. This one is about adapting to the change, finding new ways or new tools to get the task done. Let's make this really concrete. Meet Lisa. She's a new mom, but her life just got turned upside down by a brain injury. Now she has weakness in her left arm, and suddenly those essential tasks like changing a diaper or feeding her baby have become massive, overwhelming challenges.
So, what does her therapist do? Well, they don't just pick one path, they actually blend them. The remedial part involves specific exercises to help her regain strength in her arm over the long haul. But Lisa needs to care for her baby right now. So the compensatory path gives her one-handed techniques and special tools so she can be a safe, independent mom today. Now, these two paths, they aren't just ideas, they're actually formalized into specific frames of reference. The Biomechanical FOR is a classic remedial tool, zeroing in on things like strength and range of motion. But the Rehabilitative FOR, that's the go-to for compensatory strategies, especially when an impairment might be permanent. It's all about adapting the task or the environment. And look, choosing the right tool, this isn't just some academic debate. It leads to a very real scientific showdown with results you can actually measure, especially in a super complex area like recovering from a brain injury. When it comes to traumatic brain injury, two common toolkits often face off. You have Neuro-Developmental treatment, or NDT. It's a very hands-on approach that focuses on facilitating normal movement patterns to correct abnormal ones. On the other side, you have the motor relearning approach. This one's less about perfect movement and more about using meaningful real-world activities to help the brain relearn how to get things done. So the big question is, which one's better? A 2020 study in Namibia decided to find out. They put these two approaches to the test, head-to-head, to see which one actually led to better results in physical performance and daily self-care for people recovering from a TBI. And when it came to self-care, the results were, well, they were pretty clear-cut. The group that used the task-focused motor relearning approach saw a huge 78% improvement in their daily self-care skills. The NDT group improved too, but by a much lower 56%. But, and this is so important, while motor relearning won for self-care, the study found that the NDT approach was way better at reducing joint pain. It's the perfect example that there's no single best tool. The right choice is all about the specific problem you're trying to solve. Okay, so we've been talking a lot about physical recovery, but the OT toolkit is so much bigger than that. Therapists also have these really powerful frameworks for tackling the mental and emotional challenges that get in the way of us living our lives. A fantastic example is the cognitive behavioral frame of reference. The whole idea here is that our thoughts, our feelings, and our actions are all tangled up together. So if you can change unhelpful thinking patterns, you can directly change how you feel and what you do. And it's just one of many tools for the mind, like the psychodynamic FOR for emotional expression or the role acquisition FOR for navigating new chapters in life. And don't think this is just about talking. A session using this toolkit is super structured and all about action. It's not vague at all. It starts with a mood check-in, they set a clear agenda for the day, review homework, try out new strategies,
And always, always end with a concrete action plan for the week ahead. And the actual things they do are so practical and creative. I mean, a therapist might use something like breathing beads to give a child a physical tool to calm down, or a worry jar where you literally write down your anxieties and put them away. It's all about making these mental concepts tangible and manageable.
So, what this all boils down to is that occupational therapy is the exact opposite of a one-size-fits-all approach. The real magic isn't just knowing one frame of reference inside and out. The real art is being able to look at a person, understand their unique situation, and then skillfully pick and sometimes even blend the perfect tools for them.
And that brings us full circle, right back to our main analogy. A great occupational therapist is like a master craftsperson. They know their entire toolkit, from the physical to the cognitive, and they know with precision which tool or combination of tools is going to be the right fit for the person and the challenge right in front of them.
And that really leaves us with a final thought. This core idea in OT, knowing when to restore and when to adapt, knowing when to push through versus when to find a clever workaround, that's a powerful skill, not just in a clinic, but for navigating all of life's challenges. So what's in your toolkit?